اليوم هو فموضوعنا اليوم هو منه الناركوتيك انالجيسيا، يعني الاوبويد وجماعتها. ف The opioids include natural opioids and semi-synthetic alkaloids derived from opium poppy، يعني من الخشخاش. هاي مواضيع المخدرات ما مخدرات هي نسميها opium poppy. The pharmacologically similar synthetic substituted and endogenous peptide. هاي الجنرال criteria of opioids. On the basis of their interaction with the opioid receptors, the drugs are classified as, and depend on its effect on the receptors, can be classified into agonist, mixed agonist, antagonist, and antagonist. The opioid peptides released from nerve ending modulate transmission، يعني يسوي لنا modulation of the transmission on the nerve ending of the nerve. Where is this present? In the brain, in the spinal cord, in the primary afferents of the nerve pulse, and by the modulation of this the transmission, it will relieve the pain and also give a feeling of euphoria. يعني هم يقلل لنا الألم أو يغلق لنا الألم، وبنفس الوقت يحسسنا بالشعور بالنشوة أو الانتعاش. So through their interaction with the specific receptors to many of the pharmacological action of the opioids or opiates and synthetic opioid drugs are affected by their interaction with the endogenous opioid peptide receptors. يعني الأكشن of this opioid depend on its action of the peptide receptors. هسه نجي للكلاسيفيكيشن هنا، هذه هي المهمة منهن. أي spectrum of clinical uses depend on the spectrum of their clinical uses. Opioid drugs can be subdivided on the basis of their major therapeutic uses. Example: analgesic, antitussive, antidiarrheal. On the classification of this analgesia, they are either used as analgesia like morphine, methadone, heroin, and others, or may be used as antitussive تستعمل أيضا للسعال like codeine and dextromethorphan. These are also opioid. وأيضا they are used in the treatment of diarrhea, antidiarrheal drug like codeine. Codeine is the drug of choice in antitussive as antitussive drugs. They are drug of choice of resistance and strong cough, and also it are used in suitable doses as antidiarrheal drugs. فإذا الأوبويد مو فقط أنالجيسيا، أيضا يستعمل في علاج السعال وفي معالجة الإسهال. Depend on the strength of their analgesic effect, on the basis of their relative ability to relieve pain. The analgesic opioid may be classified as number one strong. يعني مثلا واحد يقول يابا السترونج انالجيسيا تسوي لنا dependence more than the weak analgesia. Is it true or wrong؟ هسه راح نوصل له ونشوف شنو القضيه.
دكتور
نمبر 1 سترونج. يعني
دكتور بلا زحمه، بس الغي الشير وشير من جديد، سوي سكرين على
ماشي.
لان ما قاعد من تقلب السيدات ما قاعد تطلع عندنا،
ما تطلع تكتب صار. هسه راح من جديد اعيدها انا. شباب هذه
نعم دكتور هسه طالعه بس
اي هسه راح اسوي لكم فيلم زين. هسه
لا دكتور هسه ما بقى الثابته.
دكتور الشير خليه على هذا، على العرض مالتك، مو على الملزمه اللي مفتوحه، على العرض اللي مسوي، على العرض السلايد الكامل.
افتهمت. هسه انتم تشوفون هاي؟
اي دكتور.
يلا نمشي الشكل وياكم.
اي دكتور يطلع احسن.
ف on the strong number one, strong, moderate, and weak antagonist. The partial antagonists and are opioids. The partial antagonists are these opioids that exert less analgesic effect than strong opioid like morphine. Morphine is a strong opioid or strong narcotic analgesia, while, for example, codeine is weak opioid analgesia. So the partial analgesia is a very weak analgesic effect or less analgesic effect than the strongest one, like morphine, which is the prototype of strong analgesic or full agonist. The morphine is the prototype of strong narcotic analgesia or the prototype of the full agonist of narcotic analgesia. تفهمون الحكي مالي مو شباب؟
اي دكتور؟
يس.
نعم دكتور.
يعني المورفين هو اللي شلون عندي رال بالبروبرانولول؟ قصدي البروبرانولول بالبيتا بلوكرز هو البروتوتايبس. فالنرجس المورفين is the prototype of these drugs. يعني because it is the strongest analgesia, so it is the prototype of non-steroidal the prototype of narcotic analgesia or the prototypes of the full agonist, because it have occupied all of the receptors of the opium. C, the ratio of agonist to the agonist effect. Opioid drugs may be classified into as agonist or partial or full agonist antagonist, or they are receptor block or mixed antagonists, which are called antagonists, which are capable of activating one opioid receptor subtype and block the other subtype. It will activate one and block the other. The pharmacokinetics of these drugs, the absorption and distribution of these drugs are mostly in the class are well absorbed when taken orally. يعني اكو هوايه كانت تجينا على شكل تابلت المورفين، يعني تقدر تاخذه باي اورال، لكنه البثيدين سوري، لكن حاليا ما دا اشوفه موجود على شكل انجكشن اللي موجود بالانعاش او موجود بصاله العمليات. اوكي. But morphine, hydromorphine and oxymorphine undergo extensive first pass metabolism. Okay. يعني when it is giving or ingest orally, it will expose to first pass metabolism. In most cases, the opium or opioids can be given parenterally. فهو عادة بالمؤسسات الصحية ينطى by injection or in the form of sustained release tablet of some drugs are now available. أنا حقيقة حاليا ما شايفه، لكن سابقا من كنت مقيم شايف أكو على شكل تابلت include morphine and oxycodone. The opioid drugs are widely distributed to body tissue. فهي من تاخذها by injection or orally، مو فقط تسويني analgesia مثلا إذا عندك severe renal pain، مو معناها راح improve the pain only، وإنما راح يصير يعني يحس بجسمه كله يبدي يقدر. Okay, because it will have wide distributed in all tissue of the body. They cross the placental barrier and exert effect on the fetus. فإذا الحوامل اللي ياخذن معناها اللي these opioids or serum addict maybe have dependencies or the fetus may be exposed to physical dependence. The metabolism of opioid with a few exceptions. The opioids are metabolized by hepatic enzyme. مو كلها، لكن اكو قسم منها مثلا مو بالليفر. Usually to inactivate glucuronide conjugate before their elimination by the kidney. However, the morphine 6-gluconide has analgesic activity equivalent to that of morphine, and the morphine 3-gluconide, the primary metabolite, is the neuroexcitatory. Codeine, oxycodone, and hydrocodone are metabolized by the glucuronide cytochrome B452D6 and isozyme exhibiting genotype variability. In cases of codeine, طبعا الكوداين هنا يستعمل in treatment of cough, and some of the codeine they are used in treatment of diarrhea. لكنه بالحقيقة the role of the treatment of diarrhea is very weak or very low. فقط موجودة بالماركت الكوداين يستعمل in treatment of cough. لكن من نسأل المرضى نقول لهم يابا انتم هو يقول لك دكتور هذا الشراب يسوي عندي كونستيبيشن قبض. الاذر كوداين اللي يسوي لنا كونستيبيشن ديكستروميثورفان اللي هو الانتروستوب اللي تعرفونه انتم هذا لوبريمايد هاي متكم اياها سابقا كمثال. This may be so in case of codeine this may be responsible for variability in analgesic response because of the drug is demethylated by the cytochrome B452D6 to form the active metabolite morphine. يعني الكوداين maybe metabolite or their metabolism will change to morphine-like effect. Maybe causing analgesia, not only stop the cough. The ingestion of alcohol will increase the activity of these drugs. Meperidine is metabolized. Meperidine is opioid, is good analgesic drug as opioid, is metabolized to normeperidine, which may cause seizure at high plasma level. Depending on the specific drugs, the duration of these analgesic or of their analgesic effect range from 1 to 2 hours. Example فنتانيل هذا يستعملونه بالعمليات الصغرى او العمليات البسيطه 1 إلى 2 ساعه ويخلص. لكن maybe to 6 to 8 hours. Example bupropion, norepinephrine. These are have long acting effect, good analgesic. However, long-acting formulation of some of these drugs may provide analgesia for 24 hours or more. The elimination of the half-life of opioid increase in patients with liver diseases. Yani, for example, those who have liver cirrhosis, the half-life of this opioid may be increased more than its original half-life. يعني الفنتانيل قد يشتغل عنده اكثر من 1 to 2 hours. اوكي؟ ليش؟ لانه الميتابوليزم ماله راح يقل والduration of this drug stasis in the body tissue is long. Fentanyl, this is other drugs, other narcotic analgesia. Fentanyl, a stronger fentanyl is metabolized by the plasma and tissue stresses and have a very short half-life. Mechanism of the action of these drugs. طبعا الاكشن مالها هي وين يصير؟ على الريسبتورز. يعني انا قلت لكم اكو عندنا either agonist or partial agonist or there is agonist, antagonist. Depending on the receptors, many of the effects of the opioid analgesia have been interpreted in the term of their interaction with the specific receptor for endogenous peptide in the CNS اللي قلنا وين؟ بالبرين spinal cord and peripheral tissue وأيضا on the peripheral tissue. فهو distributed in all parts of the body, in all the tissue of the body. ولذلك هو يخدر لنا الجسم تقريبا كله. certain opium receptors are located on the primary efferents of the nerve and spinal cord. So pain transmission neurons ascending pathways and on the neurons in the midbrain and medulla descending pathway that function in the pain modulation. هاي بعدين تفهمونها ال ascending و descending of the nerve شلون يسوي لها modulation by their effect on its receptor on these sites, the ascending pathway on the nerve and also on the medulla of the brain, of midbrain and in the medulla, and by the modulation of this function of the ascending and ascending pulses of the nerve, they may be relieve the pain and cause also euphoria. Other opioid receptors that may be involved in the alteration reactivity to the pain are located in the nerves, in the basal ganglia, and also in the hypothalamus, also in the limbic structure of the brain, and in the cerebral cortex. The major opioid receptor subtype have been extensively characterized by pharmacologically by immune receptors, delta receptors, and GABA receptors. Immune, delta, and GABA receptors. These three receptors subtypes appear to be involved in the intussusceptive, يعني مضاد للألم, and analgesic mechanism in both spinal and supraspinal level. Okay. The immune receptors activation plays a major role in the respiratory suppressant action of the opioid, and together with the GABA receptor activation, it will cause slowing of the gastrointestinal transit. The GABA receptors activation also appear to be involved in the sedation action. يعني the effect of the GABA receptor will cause sleep, and the GABA receptor activation may play a role in the development of tolerance. فإذا نقدر نرفع مثلا their effect on the delta receptors, the addiction may be not occurred. وطبعا هي صعبة، ما نقدر نرفع الدلتا receptors من هاي opioid. Okay. The opioid peptides. The opioid receptors are thought to be activated by endogenous peptide under the psychologic condition. These peptides, which include endorphin, such as beta endorphin, inside the body, and enkephalin and dynorphin are synthesized in some and are transported to the nerve ending where they accumulated in the synaptic vesicles of the nerve. On the release from the nerve ending, their action on the release of the nerve ending, they bind to the opioid receptors at this nerve ending and can be displaced from binding by the opioid antagonist. Endorphin have highest affinity for immune receptors. Endorphin, which are the endogenous substances which are present inside the body, have highest affinity for immune receptors, while enkephalin have highest affinity for the delta receptors. Means the enkephalin endogenous substances which are interact with the narcotic analgesia are more or are involved in the development of the addiction. Wrong or true or false? Look, the endorphin have highest affinity for immune receptors, while enkephalin for the GABA receptors. احنا قلنا الجابا receptors هي اللي سوينا dependence. Okay? of the narcotic analgesia. Enkephalin, which is the endogenous substances processed in the body, the narcotic analgesia will act with this enkephalin or this endogenous substances for the gamma receptor activation and قلت يعني الجابا receptor, it will lead to formation of GABA receptor are the main cause of the addiction of narcotic analgesia. Okay? بعدين راح تفهموها. And dynorphin for the GABA receptors. Although it remains unclear whether these peptide function as a classic neurotransmitters, they appear to modulate the transmission at many sites in the brain and the spinal cord and in the primary efferents of the brain, of the nerve. The opioid peptides are also found in the adrenal medulla and also in the neural plexus of the gut. That is why it will cause some of these or all of these opioid. The side effects of these opioids are diarrhea, and also it will relieve the spasm of the gut, because these opioids are also found. The opioid peptides, the endogenous peptides of this opioid are also found in the adrenal medulla and in the neural plexus of the guts. Ionic mechanism of the opioid. The opioid antagonist inhibits synaptic activity partially through direct activation of the opioid receptors and partially through the release of the endogenous substances. So either activation of the opioid receptor or activation of the endogenous اللي حكينا عنهم. قلنا اما يسوي لنا تحفيز للاوبويد ريسبتورز اللي موجوده بالبرين كورتكس، بالمدلة، بالسباينال كورد، بالنيرف اندنج، او يسوي لنا activation or reaction or release of the endogenous substances اللي هي enkephalin and others, which are themselves these endogenous peptide inhibitory. These are themselves are inhibitory to the neurons. All three major opioid receptors are coupled to the effector by G protein and activate the phospholipase C or inhibit the adenyl cyclase. At the postsynaptic level, in the postsynaptic spaces or level, the activation of these receptors can be open the potassium ion channel to cause membrane hyperpolarization. معناها inhibitory postsynaptic potential. At the presynaptic level, the opioid receptors on the presynaptic level, the opioid receptor activation can close the voltage-gated calcium ion. Like on the post, it will cause open the potassium ion channel, and by the opening of the calcium ion channel and cause hyperpolarization, maybe it will cause inhibitory postsynaptic potential. In the pre-synaptic level, the opioid receptor activation can cause voltage-gated calcium ion channel to inhibit the neurotransmitter release. Presynaptic action result in the inhibition of the release of the multiple neurotransmitters, including the acetylcholine, norepinephrine, serotonin, glutamate, and substance V. So the inhibition of the release of the multiple neurotransmitters, these can be caused by the activation of the opioid receptor, which can close or by the close of the voltage-gated calcium ion channel. Classification of the opioid in general. The opioid analgesia are related drugs, and related drugs are derived from several chemical subgroups and may classify to these. Number one, spectrum of depend on the spectrum of the clinical uses. Either analgesic, example morphine and fentanyl, or antitussive like codeine and dextromethorphan, and antidiarrheal like diphenolate and loperamide. يعني depend on their clinical uses. نقسمها إلى analgesic, antitussive, and antidiarrheal. On the strength of analgesic effects, the strong analgesic example morphine اللي قلنا هو it is the prototype of narcotic analgesia, and meperidine and fentanyl. Moderate antagonists like codeine and oxycodone, and a weak antagonist like propoxyphene. Propoxyphene is a weak opioid narcotic analgesia. Partial antagonists are opioids that exert less analgesic than morphine. Activation the receptors to the sub-maximal response. Example of this partial agonist, buprenorphine. Morphine is the prototype strong analgesia. عندنا مرض الضخ. Other strong analgesia include meperidine, fentanyl, dimorphine, heroin اسمه العلمي, dimorphine, methadone, and levorphanol. These drugs show high affinity for the mu receptors and varying affinities for the GABA and delta receptors. Varying affinities. لكنه يأثرن must be effect on the GABA and delta receptors. That is why it will cause addiction. Meperidine, dimorphine, heroin. Also the morphine itself, it will cause addiction because of its effect on the delta receptors. But this effect have varying affinities. هسه البروتوتايب هو اللي مورفين والبقية تقريبا تشبهها. Mechanism of their action, of its action. Opioids exert their major effect by interacting with the opioid receptor in the CNS. هاي حكيناها in general. الميكانيزم مالها in general قبل شوي حكيت لكم. By interacting with the opioid receptors in the CNS and in other anatomical structure, GIT and urinary bladders. Opioid cause hyperpolarization of the nerve cells, inhibition of the nerve firing, and the presynaptic inhibition of the transmitter release. The action of the morphine. Number one, it is analgesia. It will indicate it for as analgesic drugs. The morphine causes analgesia, relief of the pain, without loss of consciousness. مو منوم يعني من نعطي هذول البيشنت المورفين راح نشوف الانالجيسيا مالته امبروف كوكلي مثلا هذول اللي عندهم اي نعطيهم مورفين اور بيثيدين ذا سيم اللي هو مبردين راح improve the pain of the chest pain of the MI او renal pain لكن المريض يبقى واعي زين. انا لازم اوخر الانكزايتي، لازم المريض انيمه، لازم اعطيه سيداتيف ولذلك نعطيهم also suitable doses of the Valium diazepam. Opioid relief pain by both raising the pain threshold at the spinal cord double and more importantly by altering the brain perception of the pain. Sedation and euphoria. These Also, this is like co-sedation and euphoria, but the sedation of is very low, very weak sedative drugs, but it will cause euphoria. This effect may occur at the dose below this requirement for the maximum analgesia. The sedation is additive with the other CNS depressant. يعني بنعطيها مثلا دايزيبام. The sedation is increased, but there is little amnesia. Okay, morphine. The sedation of the morphine is additive with the other CNS depressant, but there is a little amnesic effect. Some of the patients show dysphoric effects from opioid drugs, ومعظم المدمنين عليه هذا الدراكس من الكوادر اللي يعني او من الاشخاص اللي هو في متناول ايديهم راح يشوفهم they have dysphoric effect. Show dysphoric effect. يعني against euphoria. Okay? Some patients show dysphoric effects from opioid analgesia. هو ياخذ لغرض الايوفوريا لكنه يجوز يصير عنده ديسفوريا. يعني النشوه مالته تنعكس. On the respiratory on the respiratory system, it will cause respiratory depression. Morphine causes RD by reduction the sensitivity of respiratory center neuron to CO2 at higher doses. There will be respiratory arrest. The morphine may cause respiratory arrest. Respiratory depression, so it is contraindicated to give in patients with the status of Manticas. Respiratory depression is the most common causes of death in acute opioid overdose. Depression of the cough reflex. Both morphine and codeine are antitussive agents or drugs. Antitussive properties, they have antitussive criteria. The cough suppression does not correlate closely with analgesic and respiratory depressant properties of the opioid drugs. The receptors involved in the antitussive opioids appear to be different from those involved in analgesia. Okay? It will cause miosis, the pinpoint pupil. This is the characteristic feature of the morphine addiction or morphine uses, result from stimulation of the mu and GABA receptor. Morphine exists the danger وستفل nucleus of the oculomotor nerve. هاي تذكروها بالاناتومي, which cause enhanced parasympathetic stimuli to the eye. There is little tolerance to this effect, and all morphine abuser demonstrate pinpoint pupil. Emesis, vomiting. Morphine directly stimulates the chemoreceptor trickle zone that may cause vomiting. GIT, morphine relieve diarrhea, because the phenoxylate, l'interostome diphenoxylate is a derivative of morphine. So morphine on itself, it will relieve or stop diarrhea by decreasing the motility and increasing the tone of the intestinal smooth muscles. It can also increase the biliary tract pressure. It may also increase the biliary tract pressure due to contraction of the gallbladder and constriction of the biliary sphincter. So morphine is contraindicated in patients with acute cholecystitis. ما موجودة في المحاضرة كتبوها شباب. Morphine is a contraindicated in patient with acute cholecystitis, التهاب المرارة الحاد. السبب هذا. It can also cause biliary tract pressure Okay, and due to the contraction of the gallbladder and constriction of the biliary sphincter. On the cardiovascular system, in large doses, morphine may cause hypotension and bradycardia. On the histamine release, morphine is contraindicated in patients with asthma. Okay? مساعة قلت قايلين واي الجواب مالي مساعة أنا قلته. Morphine may cause urticaria, sweating, and vasodilatation. هذول اللي يتركون المورفين او الاوبويد ابيوزر او اوبويد اديكت. وحده من الافكتس او وحده من الساين اللي نشوفها على المريض اللي هو اوبويد اديكت، المدمنين على الاوبويد لايك مورفين، بثيدين، شرابات القحه، يشوفها من يشتاق له او من يروح يصير withdrawal of these drugs، يشوفه يصير عنده ياونج يعني يتثاوب، بعد يصير عنده لاكريميشن، يشوف يصير دمع عنده، وكذلك بتقول يشوفه يصير عنده افرازات secretion from the nose. Why? This is the answer. Sorry. Because histamine release morphine is contraindicated in patients with asthma. Morphine may cause urticaria, sweating, and vasodilatation. Will cause vasodilatation. Okay? فهيسوي لنا nasal congestion and also nasal secretion. هذول اللي ويصير عندهم ياوينج يثاوبون وبعد يصير عندهم lacrimation. Hormonal action, the effect of this on the hormone, it will inhibit the effect of morphine on the hormones. It will inhibit the release of the gonadotropin releasing hormone. And also, it will inhibit the release of corticotropin releasing hormone, while decreasing the concentration of luteinizing hormone, FSH, ASH, and beta endorphin. Testosterone and cortisol level are decreased when morphine are taken. Increase the prolactin and the growth hormone release by administering the dopaminergic inhibiting of these drugs. Chronic effects of this drug. Number one, tolerance, which is عناوية by the effect on the delta receptors. Where dependence also the same. It's a physiological receptor to chronic therapy with opioids, especially strong analgesia. What is the difference between tolerance and dependence? These are two terms used when we talk about the addiction. Abstinence syndrome عندما الإنسان أو عندما دول الأديكت are withdrawal suddenly from using of this drug. في سرعتهم abrupt or sudden discontinuance of the opioid may cause rhinorrhea, lacrimation, chills. شوفه يرجف شويه يصير عنده يحس بروده, muscle ache, diarrhea, and anxiety and hostility. Degree of the tolerance that may develop to some of the effect of opioid. These high, moderate, and minimal or none. Analgesia, euphoria and dysphoria, mental cloudiness, sedation, respiratory depression, antidiuresis, nausea and vomiting, cough suppression. While the moderate, bradycardia, minimal or non-meiosis, constipation and convulsion. may be developed as a side effect to the opioid. Pharmacokinetics of the morphine, oral morphine is subjected to extensive first pass metabolism. Only 20% of the dose reach systemic circulation. Given either subcutaneously or by the intramuscular, is rapidly absorbed, but circulation shock, it is better to be given IV. Morphine is metabolized by the liver and the kidney. The conjugated metabolites include the pharmacologically active morphine 6-glucuronide and morphine 3-glucuronide. The half-life is 3 active metabolites highly longer, and the duration of the useful analgesia is 6 hours. Morphine crosses the placenta and suppresses the respiratory of the fetus at the birth. Therapeutic uses of the morphine as analgesic agent, and also it is used in acute pulmonary edema. بعدين نعطيكم treatment of acute pulmonary edema or acute pulmonary or acute heart failure. Intravenous morphine dramatically relieve dyspnea caused by pulmonary edema associated with the left ventricular function, possibly by vasodilator effect. Also, it is used as analgesia. Opioids are used pre-operatively medication and as intraoperative agents. High doses intravenous morphine and fentanyl كما نستعملها كمخدر بالعمليات are the major component of the anesthesia of the cardiac surgery. Okay. Adverse effect of the morphine: respiratory depression, vomiting and diarrhea are largely enhanced hypotensive effect, elevated of the CSF, acute urinary irritation in prostatic hypertrophy. Morphine, so it is implicated to giving in those patients with benign prostatic hypertrophy. Morphine should be used with caution in asthma and liver failure. In status asthmaticus are contraindicated, but in asthma it is used but with caution. Fentanyl, the other drugs بعد المورفين هو الفنتانيل. شباب عندكم سؤال؟ افتحوا المايك. هذا نكمله ان شاء الله بالنظري بالحضور.
واضحه ان شاء الله دكتور، شكرا جزيلا.
واضحه وتقروها بالبيت ان شاء الله وشوفوها بلا زحمه، مو تاخروها، اقروها اليوم على السريع. زين؟